Hi, folks. Um, Thanks for inviting me. I haven't seen Terry Fulmer since she was a young nurse in our wards of the Beth Israel. Um, and, um, and I know many of you, and I've admired more of you at a distance, so I'm delighted to be here. So we've had a lot of discussion about problem definition so far, and I'm going to try and suggest a new medicine that will help in addressing some of these extraordinary problems. Um, So I will describe the problem that I've been addressing recently in a current adventure that we call OpenNotes. I'm going to tell you a little bit about what we've learned from it and then try and get you to argue with me because I love to debate people. I'm going to skip this. This is the Schloss Leopoldskron in Salzburg, where I've been privileged to lead several seminars. And the most fun I ever had was in a piece of work that we did on inventing a healthcare system that we called People Power. Madam Prime Minister had swept into power by promising her citizenry that she would design a healthcare system through the patient's eyes. And we had a week of storytellers and poets and policymakers and doctors and social scientists and nurses and social workers working on developing this healthcare system. And a nurse from Norway, I always bring up her name because everyone else takes credit for this, said that the mantra for our session should be nothing about me without me. It turns out actually that this is an old Polish aphorism. I gave a talk and a Polish oncologist came up to me and said, nothing about us without us has been part of Polish law for about 500 years. So I just want to set the record straight. But one of the things that we came up with in this session was that in this future healthcare system, not only will patients have complete access to their medical record, and I think you can substitute the word caregiver for almost every time I mention patients today, and that's what I'm going to ask you to do. Although they don't have to review the records if they don't want to, but they'll also write in it, elaborating, tracking, and explicating problems, correcting mistakes, prioritizing needs, and at times suggesting both diagnoses and treatment plans. So frame that for what I'm going to talk about for the next few minutes. Here are two nice statements. The goals of OpenNotes. Our 21st century value-based healthcare delivery system requires that patients, and I put in the word now caregivers, are actively engaged in the health and healthcare decision-making. You heard eloquent discussion of that in the problem definition set before I came up. And that OpenNotes might give patients and caregivers a more complete picture of their loved one's health and empower them to make better, smarter, and more economical decisions about their care. So I gave this talk at the Cleveland Clinic, which boasts about having OpenNotes, although I think about 2% of the patients read them there. And I asked them who they thought had said this, and they didn't have a clue. And it was from the press release that they had put out. I'm a difficult person, but the point is that to disseminate this kind of culture is not so simple, and I want to emphasize that. So what are we all about? We began about almost 5 years ago now with 100 primary care docs and about 19,000, 20,000 of their patients in Boston and Pennsylvania, rural Pennsylvania, Geisinger, and in the inner city in Harborview. So we had a real cross-section. And we invited patients to read their notes, the notes that we wrote. And we sent them an email saying, Thomas, just sign your note. Judy, you're allowed to read it now. Please do so. We published findings about, it's about 18 months, 2 years ago now, actually. This is out of date. And we've got about 5 million patients now in the country reading their notes, or at least having the access to their notes. So what's going on with this, and how does it relate to caregivers? We asked 3 questions. Would it help patients become more engaged in their care? Would it help caregivers become more engaged in their care? Would it kill the doctor? And after a year of doing this, what would happen? Would people want to quit, or would they want to go on? Doctors were very scared of this, and you've already heard doctors maligned in the morning, and this will go on for further parts of the day. And I understand it very well. About half of them expected real disruptions in their workflow. They expected to change the way they wrote about mental health issues, about substance abuse, about cancer. And a year later, what had happened? Only 3% had noticed anything. In fact, the most common question I was asked is, are you sure the computers are working? And some of them did change the way they wrote notes, but that was fine. You know, when I write SOB, it means shortness of breath to me, but it may not mean that to you. So we changed some of the rhetoric. Patients, on the other hand, were very, very thrilled by what happened. They want the notes, they read them, they're not scared by them. They report important clinical benefits, and they share them with other people. And this is central to what we're discussing today. 4 out of 5 read at least one of them, and now we've got studies saying that they continue to read them if you remind them to read them. Very important part. Very few of them were scared or made worried by them. Much, much, much fewer than the great doctor anticipated. And they reported really important clinical benefits. They felt more in control of their care. The caregiver, I think, will feel more in control of care. They felt better understanding of health and medical conditions. They better remembered the plans for care. They felt better prepared for subsequent visits. And we had an extraordinary statistic in that 2 out of 3 felt that they told us they were taking the medicines better. And we're now studying this in an aggressive way. And we're quite excited by what we're finding. But that would be an extraordinary change in behavior. Also for caregivers, if you think about it. You heard about 12 medicines. You know, you don't have a clue what those 12 medicines are for, what they are. You mix them up. They're all in a pot. And being able to go at home and download a note and read about it and understand it or get back to us and say what's going on can make an enormous difference. 99% of patients wanted to continue with this after a year, whether or not they read the note. Remember, 4 out of 5. We had a young woman in Maine said, I want it, it's mine, give it to me, but I may not read it. A nice Talmudic argument. And it's the kind of thing that excites us. 85% said whether or not they had open notes might determine their future choice of a doctor. Not one doctor asked to stop. And we don't know yet in this country of a doctor who started open notes who's dropped out of it. And all 3 of our institutions decided to expand it. So at Beth Israel, now every ambulatory note, whether written by a doctor, a nurse, an occupational therapist, a physical therapist, a clinical pharmacist, and increasingly a social worker or a psychiatrist, is open to the patient and can be read. We're having quite an adventure with this, and we're not alone. We've got the early adopters, the fancy people in America are doing it. You can find your favorite fancy place on this: Mayo Clinic, Cleveland Clinic, our Harvard Hospital. Group Health is now doing it, University of Washington. Stanford is now piloting it. Cedars-Sinai is now piloting it. The early adopters are taking this up. And we're engendering competition. We're getting people to compete. We're being very aggressive about this. We're working with the vendors. Epic is now offering it this year as the default application for their new installations. And we're having a lot of fun making trouble. We're trying to help people. We have toolkits on our website. You can look at it. We're helping patients. We're just working on a caregiver module. We're helping providers. We're helping institutions that want to change. So let's focus on the caregivers for just a minute. Before I do that, I'm going to also integrate the issue of mental health, because you heard already how central it is to all of this. We wrote a paper in JAMA beginning of last year saying, let's show patients their mental health records. You know, front page stuff everywhere, lots of yelling and screaming. Some of my Freudian friends thought I ought to lie down on the couch and talk to them about what's wrong with me. Others thought it was a very good idea. It has made an enormous difference, we think, and is also part of this. What about sharing notes? In the original study, 24% of the patients shared them with their loved ones or their informal caregivers. In a recent survey by a big place, 46% of the patients are sharing them with someone else. It can be a caregiver, it can be their cousin, the doctor, their aunt, the lawyer, their sister, the nurse, whoever it is. In this study, a third more plan to do so. So this is very different. My relationship with you is confidential. Whether or not it's private is now up to you, right? Big difference, very important implications. Proxy systems are proliferating. I mean, Geisinger, at our place at the Mayo Clinic, you can sign a proxy saying that my caregiver has the right to read my record. And anyway, you don't need proxy systems because all you do is you look over someone's shoulder or you get the password and you ignore HIPAA. You don't obsess over HIPAA. You obsess over the patient and the caregiver and you move along. You can expect a lot of things to go well and you'll have some disasters. That's true of any new medicine in life, right? But the greater good for the greater number is what we're about. And we think this has enormous implications, both for patients and for caregivers. We expect it'll become the standard of care, and I want it to happen in a hurry because I'm old. So here you have a Venn diagram, right? What are we talking about? HIT, I'm going to shut up. Transparency, patient engagement. I flick another switch. It's caregiver engagement, right? That's what we're talking about. This was a scandalous cover of the BMJ about 20 years ago when we were working on learning from patients, and I did something called the Picker Institute where we were gathering material from patients. The interesting thing about the scandal was here was a doctor dancing with a patient, right? The nice thing is that in 2015, you don't know who's the doctor, you don't know who's the patient, you don't know if it's a nurse, and you don't know, I think, whether it's a caregiver. So I commend what we're doing to you. I would love to debate it with you. Take me on and go to our website if you want to learn more about it. Thanks very much.
Thank you so much. We'll hear now from our third panelist, Dr. Zaldi Tan.